Well, joining me live is Executive Director of the Victor Chang Cardiac Research Institute and cardiologist Jason Kovacic. Thank you so much for joining us, Professor. Very sad news and just unfortunately another example of how serious our hearts and our heart health.
Exactly, Janie. Thanks for having me on. Look, the story of Vicky Roycroft, again, another example of how common heart disease is, and of course our thoughts are with her and her family. But this is such a common problem. It's a day-to-day thing we see, and it really reminds us of the importance that we need to think about our heart health and get those heart health checks.
Now, correct me if I'm wrong, but is heart disease still the #1 killer in Australia?
Right, heart disease is the #1 killer. It really is a pervasive problem across the country, and it is fixable to a certain extent by addressing traditional risk factors like blood pressure, cholesterol, diet, lack of exercise, smoking, all of those common things. And it's really important that we think about those things to improve our heart health.
And Professor, as you well know, there's been a lot of media interest in heart health checks recently. Talk us through some of the latest.
Right. It's a really big issue at the moment. So the government had a Medicare rebate item they put up about 4 years ago for heart health checks, where people could go to their GP and under Medicare have a comprehensive evaluation of blood pressure, cholesterol, glucose, take a history, examination, and then those risk factors could be addressed. With the budget coming up, it's time for a renew of that Medicare item number, and there is some concern that that item number may be taken away. And of course, it's a balance between GPs wanting to provide holistic care versus a focused heart health check, but we certainly see there's a lot of value in the heart health check because it's enabled the heart community to come together to advocate strongly for people, the general community, to go and get those heart health checks so that events like we saw today can be avoided.
And again, getting back to that statistic of it being the worst or the biggest killer in Australia, and that statistic has been around for years.
It's been the way, it's been the #1 killer for a long, long time. And that includes heart attack, stroke, heart failure. It's a whole gamut of heart problems. It is complex, but it does come down to those common risk factors: diet, lack of exercise, being overweight, blood pressure, and so on. Those risk factors really drive all of those problems.
One risk factor, what you've got there, salt. Or
so
this good salt.
There's been a lot. It's really a breakthrough. There's been a lot of research done over the last couple of decades showing that traditional salt, which is sodium chloride, really puts up our blood pressures, and sodium is the main driver of blood pressure. So there's been a move to take out some of the sodium and swap in potassium, and studies have just been published showing that if you swap sodium for potassium, then we can actually reduce blood pressure and reduce the risk of stroke and other cardiovascular problems. So this salt substitution with these potassium-enriched salts is really important, something to think about. And you can see there that these potassium-enriched salts are available in most supermarkets, often marketed as heart salt, but there you can see one there, heart salt, and they come in a couple of different flavours, easy to get from the supermarket, and I can say I can't tell the difference in how they taste.
Isn't it interesting though, like you go to the fish and chip shop or whatever and they pour the salt on and
pour it on,
and foods that we don't even know that have salt in it. We've got to do something, don't we, in terms of government regulation? Right.
The government's been making inroads in this, and we've seen bans against trans fats. We've seen regulation coming in around sugary drinks, and it's a stepwise thing. We have to absolutely have the buy-in of the public that will make these changes in their diet with us. But, replacing sodium salt with potassium salt at a global level would be a wonderful thing. We actually saw iodised salt come in a few decades ago, which was to help with thyroid problems because iodine deficiency. So that saw a complete resetting of the salt market around the world. So colleagues of mine at the George Institute are actually working to see what would be involved, what would it take to change the global salt market to enrich with potassium. Wow. It's a really exciting thing, and it could save many, many lives.
Well, before we let you go, our executive producer, as you're walking in with the salt, he said, "I'm not allowed to have salt." So for people that are not allowed to have salt, can they have a product?
You have to. There are some, because potassium itself, you have to check with your GP if there's problems. But for the overwhelming majority, it's absolutely safe. And of course, the trick is don't just pour this potassium salt on and think, oh great, I can have as much as I want. It's not the case. Replacing a bit of the sodium salt with potassium salt is the way to go.
Thank you as always, Professor. Nice
to see you. Thank you.